Our next presenter is Dr. Melissa Vilaro. Dr. Vilaro is an assistant professor of health and wellness in the Department of Family, Youth, and Community Services at the University of Florida. She previously completed postdoctoral training with a focus on cancer health communication and strategic message design at University of Florida's STEM Translational Communication Center, where she received a National Cancer Institute research supplement to promote diversity and health-related research. She also worked as a postdoctoral associate at University of Florida's Food Science and Human Nutrition Department, where she coordinated a USDA-funded health promotion and social marketing research study. She earned her Ph.D. in Public Health and her Master's of Public Health from University of Florida and a Bachelor's in Association from Tufts University.
Good afternoon, everyone. Thank you so much for having me today. My name is Melissa Vilaro, and I'm an assistant professor at the University of Florida. I'm really excited to present today. I do health behavior change research and look at food choice and dietary adherence among diverse populations. I look for ways to improve overall health, and what I'd like to talk about today is how we can actually use what college students say is most important for their food decisions to get them to change their behavior and eat more fruits and vegetables. Okay, so I'll largely be talking about the Food Choice Priority Survey, which resulted in 2 published manuscripts. So if there are any details I don't discuss in terms of methods or more detailed outcomes, you can feel free to find them in these papers here. But essentially, what we did was we wanted to know, why is food choice important, right? And we wanted to look at that in the college student population. And there were really 3 reasons why it's important to look at food choice in this population. So first, behaviors that are established during the college years really do persist into adulthood. And recent findings from the spring 2022 National College Health Assessment found that there's a lot of room for improvement in terms of the amount of fruits and vegetables that college students are eating. Second, we make several food-related decisions every day. These are continuous, they're ongoing. And so there's a lot of opportunities to shift the balance and help people make healthy choices. And there is a long line of literature that talks about the drivers of food choice. They include typically 5 common things: taste, health, relationships, money, and convenience. And so we really wanted to look at this in a college student population, given that these have been established domains of food choice for adult populations. And so I had the opportunity to talk about this, or look at this through a sub-project of a larger study called Get Fruit. And this study looked at promoting healthy lifestyles among college students. And these are some of the students that worked with us on this study. This study occurred in 8 universities throughout the state, and it was USDA funded. These are just some of the intervention and control sites. And we implemented a social marketing and environmental change intervention. So I was able to create a project to answer some of the following research questions. First, I wanted to know, what are the specific factors important to college students when making food choices? Second, I wanted to know, are their food choice priorities for students the same as the ones that we know are important for adults? And are there any additional factors that we can identify? Second, I wanted to know, how did these priorities, how might they change over the course of a freshman year? And last, I wanted to know how that might be related to fruit and vegetable intake. And so by understanding priorities, I was hoping to be able to gain insight into how much fruit and vegetable intake students might have. So we conducted individual interviews and focus groups with 37 undergraduates. I analyzed the data, and from that identified 14 items or factors that influenced food choice decisions. We used this information to develop the Food Choice Priority Survey, which asks students, what are the main factors that influence the food you eat on a regular basis? So here, students can rate each item on its level of importance. To validate the Food Choice Priority Survey, we essentially we validated it to determine if we had a good tool that could be used and administered reliably. So we took data from just over 1,100 students from the Get Fruit study. We did a factor analysis, which revealed the 3 scales you see here. And so each scale is composed of several items that kind of all hung together and related to how students were answering the question. There were an additional 5 items that did not load onto a scale, but because they were important and identified from the population, we do include them and we just rate them on as individual items. And so once we had developed and validated the tool, we were able to use it to answer our proposed research questions. Here you can see the overall study design, and students were eligible to participate in the larger Get Fruit study if they were considered at risk for weight gain in the first year of college. And so students from all of the 8 partner universities completed the assessments, which included the Food Choice Priority Survey, as well as other measures. And then for analysis, we conducted paired sample t-tests and multiple regression models, which examined associations between the food choice priority and log-transformed dietary intake, controlling for sex, age, race, and BMI. And so here's what we found regarding what food choice priorities were important for students at the start of the year. And so you can see the most important on a scale of 1 to 5, with 5 being extremely important, were those scale C items representing the busy daily life. So things that included taste, routine, convenience, and ability to feel full. And price was also very important. So those were the top. And then you can see how the others rank in importance, with the advertising environment being perceived as the least important. And so if you remember, we also wanted to know if they changed across the first year of college. And we found that half of them significantly changed. So the healthy aesthetic scale, as well as the importance of significant others, peers, and the advertising environment for food choice, those did not change. But the arrows that you can see here, up or down, represent the ones that did change. So I think I named a few in the wrong category, but the arrows are representing the domains which had significant change. And so you can see that the importance of family decreased by the end of the freshman year, but all of the other ones increased in importance. And so if you're a numbers person rather than a visual person, here you can just see the mean and standard deviations from the fall to the spring, beginning of year, end of year. So this is just the numbers that represent the image that came before. We also wanted to know how food choice priorities related to fruit and vegetable intake. So we were just interested to know, could we actually identify how many how many servings of fruit and vegetables students were eating based on their priorities? And we found that actually, yes, we could. And so when we looked at these scale B items, which was the food choice driven by a healthy aesthetic, we saw that for each additional increase in importance on the FCPS scale, fruit and vegetable intake increased. And so what does this mean? It means that as a student goes from a 1 on rating the healthy aesthetic items as not important to a 2, saying it's slightly important, that student rating a 2 will eat potentially, let's say, half more cup of fruit and vegetables per day compared to the student rating a 1. So that also means that a student rating a 5 will eat more than a student rating a 1 or a 2 or 3 or 4. And so potentially, if you think about the difference in importance between these two numbers, that's enough to move someone from not getting the recommended amount to achieving that important health behavior. And perhaps even more interesting are the food choice priorities that predicted lower fruit and vegetable intake. And so for price, for each additional increase in importance on the FCPS scale, fruit and vegetable intake we found was decreasing. And for the busy daily life and preferences items, we also saw those going down. So every time those items are rated as important, for each additional level of importance, fruit and vegetable intake decreased. And so again, we can visualize this by someone who's saying these are not important, this busy daily life, they might be eating more fruits and vegetables compared to a student who's saying these are really important factors in my decisions around food. And so given what we know about the impact on eating fruits and vegetables for overall health and mortality, this is not only a statistically significant decrease, it's important for health behavior researchers like myself who are trying to find all the clues we can to nudge students in the right direction towards health. It's also important and interesting to note that these two items, price and the scale C items, were two of the ones that became more important to students by the end of the freshman year. So they're becoming more important as they go through college, but they're also negatively impacting fruit and vegetable intake. These are other dietary components that we looked at. If you remember, I said we did look at sugar-sweetened beverages, added sugar, and fiber. And the paper goes into all of the details of those relationships as well, but we look at them by each of the food choice priorities. And you can see that the blue arrows indicate the directions we'd like to see. The red are directions we kind of would not want to see in terms of intake. So what do these findings tell us? Essentially, when food choice is driven by price or a busy lifestyle, students eat fewer fruit and vegetables, and price and those busy lifestyle factors increase in importance by the end of the freshman year. We also find that the healthy aesthetic, that priority did not change in importance across the first year. Rather, it was stable. It did have one of the largest impacts on fruit and vegetable intake in terms of the rate of increase per importance. And so this gives us some important information to help us tailor health communication strategies and interventions to move students in the direction that we know is healthy. And overall, a lot of this work has been applied and used in other contexts. A lot of these students have gone on to do things in medical school or other areas of health, but most importantly, we were able to identify some really interesting trends and contribute to the literature. So thank you for listening to my talk, and I'm happy to take any questions by email. Please reach out if you have further insights or questions about these studies. Thank you.
Thank you, Dr. Vilaro, for your presentation.